So we've arrived on scene where a male has fallen 2 meters off the ladder, trimming his tree. Straight away I can see that the saw is still in the vicinity, but is far enough away that it's not a danger. Other than that, there are no obvious hazards around. I can see from here that the male has an approximately 15 centimeter laceration on his left arm, and his right leg is angulated. Because he's on grass, I can't quite see how much blood he's lost, but you can see that his wound is still bleeding. Do you feel safe to enter the scene?
Yes.
Alright, when we first get there, can I get you to set up the kit at his head and get the wound management ready? Hi sir, my name's Hannah and this is my offsider Sarah. Can you tell me what your name is? Alright, thank you. So the patient has spoken and has stated his name, and that shows me that his airway is clear. Can I have some saline and a gauze please? Thank you. So first off I'm going to rinse his wound with saline, and I am going to get the gauze and put saline on the gauze so it's not sticking, and apply pressure. Next, can I have a bandage please? Thank you. And now I'm going to bandage up his arm. Can I get you, Sarah, to come and just aid his arm please? I'm going to apply nice tight pressure when bandaging up his wound and the gauze. And once I've applied my base layer of bandage, I'm going to start putting twists in it to get more direct pressure. Keeping a nice tight grip on there. Alright, that one's done. Thank you, Sarah, you can place that down. Alright, so I can obviously see that the blood has already seeped through his bandage. So Sarah, can I have another dressing please? And we're just going to put another wrap on that. And can I get you to assist his arm again? Thank you. Alright, now that is all dressed up. Thank you. Yep, you can just leave it go. Okay, so I can see that this is still bleeding. I'm going to now apply a tourniquet to that. Using the tourniquet, I'm going to ensure I put it on a one bond limb, approximately 10 centimeters proximal to the injury. I'm going to put that there, nice and tight. And then what I'm going to do is I'm going to do 3 to 4 turns of this to make it nice and tight to ensure that the bleeding is stopped and managed. And then I'm going to pop that back on and write down the time. And now I'm going to, first of all, I'm going to feel for a heart rate. Right, heart rate is slowing. I'm now going to take off the bandage so we can check on that bleeding. Thank you, Sarah. You can let that go. Right, I can see that the bleeding has stopped. If the bleeding had continued, I could apply a second tourniquet if I needed to. So now I'm going to check for a pulse. Perfect, there is no pulse, and the capillary refill is delayed. Alright, so we've now applied a tourniquet to the wound. I would now call for backup. So backup has just been called. So next what I want to do is I want to complete a secondary survey. Sorry sir, can I just get your permission? I just need to assess the rest of your body to find out whether or not you have any other injuries. Is this okay with you? Patient has consented to this. So I'm now going to have a feel around for any other possible injuries. I'm going to start with the head. Head seems fine. Forehead, nose, cheeks, jaw, neck. So patient has voiced that he has some tenderness in his neck. Excuse me sir, can you just tell me whether it is when I press in the middle here or on the sides here? So he has voiced that it is a midline tenderness. So what I'm going to do is, can I get my offsider to first of all get me a towel just to place under his head, just so he's a little more comfortable. Just get you folded up like a square. Thank you. So I'm just going to lift your head for a moment here, Sarah, on my lift. 3, 2, 1, lift. Excellent, cool. And can I get you to hold his head stable? So we're just going to hold the head stable just so we don't irritate any possible fractures in there. I'm just going to continue with the survey, sir. So I'm going to go from the collarbones, down the sternum, across the ribs. Can I get you to take a deep breath for me, sir? Right, ribs are stable. I'm going to try to go down this arm. No broken bones. No, nothing. Alright, I'm just going to have a prod around your stomach here, sir. Abdo is fine. Pelvis is alright. Alright, so I'm just going to go down your legs now. Alright, left leg seems fine. I'm going to try with the right leg. So patient has voiced some irritation on the right leg, so by pulling this up I can see that his right leg is discoloured and angulated, meaning there is a possible fracture there. I'm going to attend to that after I attend to his neck. Alright Sarah, so what I'm going to do is I'm just going to put around you here and get his C-spine collar. So we're going to put a C-spine collar on to stabilise his fracture, just in case it worsens. We want to keep his neck still. So what I'm going to do is, first of all, I'm going to measure it. So I'm going to go from his shoulder to his jaw, and then I'm going to measure from the line. Excellent. So the collar has already been set up to his size. So what I'm going to do, Sarah, is I'm going to slide this on underneath, and on my left, I'll get you to lift his head up slowly and slightly. 3, 2, 1, lift. Sarah, and down. Excellent. Thank you, Sarah. I'm just going to pop this around here, Sarah. I'm going to make sure it's nice and comfortable, and we're going to secure it there. Alright, so C-spine collar has been secured. Our patient's neck is now secure and possible fractures are stable. So now that his collar is on, I have just done a quick double check of the tourniquet. His bleeding has ceased, so I'm happy with that. So in relation to your pain, can you tell me on a scale of 0 to 10, 0 being no pain and 10 being worst pain imaginable, whereabouts is your pain at the moment? So our patient has stated that our pain is at approximately an 8, and his GCS is currently at a 15, so I'm happy to administer some analgesia. So my offsider Sarah here, she is just going to run a set of vitals. Is that okay with you? She just wants to check your blood pressure and your pulse and such on your arm. Is that alright? Cool, so our patient has given consent for vitals, and I am now going to talk about our methoxyfluorine. So, alright, so this analgesia here is called methoxyfluorine. We're going to administer it to you because of the pain in your leg. Can you just tell me, have you got any allergies to medications? Our patient has stated no. Does your family have any history of malignant hypothermia? He has also stated no. Alright, so have you seen or had this in the last week, or have you seen it ever? So our patient has also again stated no, he has never seen methoxyfluorine before. Do you presently and currently have any renal or kidney problems? He has stated no, and are you happy to be taking this? Our patient has consented. So before I do anything, I'm going to check the date, which is 2020, so it is not expired. It is 1 ampule of 3 milligrams, and it is methoxyfluorine. I'm just going to get my offsider to do a quick drug check for me.
1 ampule, 3 mils, methoxyfluorine, 2020.
Excellent, thank you. Alright, so our patient is obeying commands, so I feel happy to administer this to him. So when taking methoxyfluorine, what I want you to do is I want you to pop your lips on this bit here and take deep breaths in and out using this, okay, on the tube. It's going to taste a little funny, you may feel sleepy or dizzy after using it, and a few side effects are going to be nausea and possible vomiting, but it alters with patience. So what I want you to do is every time you're in a bit of pain, take a deep breath and relax, and then another deep breath and release, keeping your lips sealed around the whistle, okay? And if you feel it's not giving you enough release, just cover your hand over the hole here and take a deep breath in. Are you happy to do that? Excellent. I'm going to wrap this around your arm over here while we wait for my offsider to complete her vitals. So with methoxyfluorine, you would be using it in conjunction with either Panadol, Tramadol, or ibuprofen. In this case, we wouldn't be using paracetamol pills because of the neck brace on our patient. We would use instead liquid paracetamol. And yeah, if he had any access to IV lines, if our backup had arrived by then, if pain got worse, we could also put in an IV line for pain relief. So we have now administered methoxyfluorine for our patient. If our patient was a child, we would give them 3 milliliters of methoxyfluorine, and for an adult we would give 6. So if need be, once this ampule runs out, we could administer another one if he's still in pain. So what I'm going to do now is I'm going to sort out his leg. While I'm just doing some vitals on his leg, can I get you to set up a splint, please, and get some triangle bandages ready? Right, so what I'm going to do first is I can obviously see a colour difference between the two, and I can also see that this one has been a little bit swollen. So sir, I'm just going to touch the inside of both your feet. Can you tell me if you can feel both of them? Can you feel that? Right, so patient has stated that has less of a sensation than this one. Capillary refill time is a bit slower on this one than it is on his non-injured foot, and I'm going to get the pedal pulse. Pedal pulse is a little slower on this foot. I can also feel by touching his feet that his injured foot is quite much warmer and is a little bit more sweaty. So what we want to do now is we want to put his leg in a splint. So putting his leg in a splint, we do this to stabilise possible fractures. We also want to help with the blood flow and get the circulation back. Also just to make it a little bit more comfortable for the patient and stabilise it for transfer. So, we ready with the splint there? So what we're going to do is, with the natural grooves of his legs, we're going to put the bandages under and have them set there. I'm also going to do this one, thank you. And that's just going to be waiting for our splint. So what I'm going to do, Sarah, is I'm going to lift up his leg, and on my go, can I get you to slide in the splint? You ready? 3, 2, 1, go. Take some nice big puffs on that methoxyfluorine pen for me, sir. That might be a little bit sore. So what we're going to do now is we're going to tie it to keep it stabilised. We're going to tie it on the outside here, because putting it here could hurt his fracture, and putting it here could give him pain on his other leg when it rubs together. And with this bandage here, what I'm going to do is I'm going to just do a crisscross, and I'm going to tie it back here as to stabilise and put some pressure on the bottom of his foot. Awesome. So now that that's done, I'm going to run over my vitals again. So sir, again with touching your feet, can you feel both of that? Yep, so you can feel that. I'm going to do the capillary refill time. Alright, that's gone back to 2 on both feet, and that's excellent. And pedal pulse. Pedal pulse is much better. His temperature is still a little warmer, although definitely reduced, and the swelling looks like it has reduced slightly as well. Right, so for his full set of vitals, the first one I'm going to do is his heart rate. So to find out his heart rate, I'm going to find his radial pulse by putting my 2 fingers here and feeling around for the pulse until I can feel it. I'm going to feel his pulse for 15 seconds, and then when I get the result of how many pulses I get in 15 seconds, I'm going to times that by 4 to get our overall heart rate. Right, so we have a heart rate, so if timesing that by 4, we now have a heart rate of 80. What we would do now is we'd get up, this won't bend because he's a dummy, but what we'd get our patient to do is cross their hand over their arm, and we would rest their arm on their chest. So it looks like we're continuing with the pulse, but really we're going to now look for the rest rate. So by doing the rest rate, we're going to count for 30 seconds and times that by 2. So we'd watch the rest rate. Right, so his rest rate in 30 seconds is 9. We want to times that by 2 to get a full minute. So his rest rate is now at 18. So his rest rate is just how many times he takes deep breaths in and out, and it's a hiring going up and down on his chest. Next, I'm going to check his blood pressure. We want to find the systolic and the diastolic number. So to do that, what we're going to do is we're going to put the end of our stethoscope on his brachial pulse, and then what we're going to do is pop that there so I can see it. And we're going to pump it up until we can't hear anything. And I keep pumping all the way up, and then I'm going to slowly release it until I can hear his first heartbeat, which is at 120. And then what I'm going to do again is I'm going to pump it up an extra 30, and then I'm going to release it again, and then it's going to beat, and then when I can no longer hear it, is our diastolic number, which is 80. So our patient has a blood pressure, of 120/80. Next, what I'm going to do is a capillary refill time. So normal capillary refill time is 2 seconds. Our patient previously had 3, and he now is at 2, which is normal. Checking the capillary refill time, the reason we do that is to check for the distal perfusion, seeing how long it takes for the blood to refill the artery. Finger. So what I'm going to do now is I'm going to auscultate. I'm just going to take a listen to his chest and see if I can hear any abnormal signs. So I'm going to do it at 6 points. 1, 2, 3, 4, 5, and 6. So as my offside has said, his chest is still clear. We cannot hear any abnormal signs or sounds. So regularly for an adult, we would have a heart rate of between 60 to 90, so our patient is in with that range with 80. His rest rate is between 12 and 20 is normal, and his rest rate is 18, so that is also within normal range. I'm happy with that. And his blood pressure is at 120/80, which is what is considered normal for an adult. So now what we would do is we would continue to just watch over him until backup arrives and we can transport him to hospital.